share the recording as well. So basically, there are two initiatives here that we want to discuss with all of you. So one of those initiatives is that you can partner up with us, do the internship with us in Health Innovation Journal. What is Health Innovation Journal? It is a open peer-reviewed journal of medical science. The journal basically is sort of like a reaction to the rejections that researchers face when they are applying from the global south to research journals across the globe. The failure rate is very high for our authors coming from low and middle income countries. And precisely a very big reason for that is that the researchers in this part of the world are unable to pay the article processing charges of the journals that are based in the global north and the global west. So what we are trying to do is that we are trying to set up journals across the global south, across the low and middle income countries, where we help our researchers to publish as much as they can in the in journals that are based in global south. But we don't want these journals to just be journals that are developed. No, we want these journal number one to be indexed. Number two, these journals should have a high citation index. At the same time, what we want is that these journals should be in the top 50% at least of the global ranking of journals in that specialty. And so the reason why we have chosen the name Health Innovation Journal is because innovation can apply to a whole host of things in healthcare. So we don't just want to limit it to people who are doctors or people who are within the health space when it comes to service delivery. No, we can have people from all areas, even people who are working in genetics, people who are working in stem cell research, they can be part of this initiative. With that being said, so this internship, when it comes to the Health Innovation Journal, is that we have invited all of you here that you can number one learn to develop your own journal using something called as OJS, Open Journal System. So we have here in the meeting Mr. Asad. Mr. Asad is our chief engineer for all of these projects. He has developed and curated a workshop for all of you. The YouTube video is already out there. Everything that we have done is free. Number one is the OJS, how to set up your own open journal system using XAMPP and also using XML. And then apart from that, the other thing is if you develop your journal, now how do you get that journal indexed? Um, Furthermore, we don't stop there. What we do is that anyone who develops a journal with us, all of you can develop journal, health and innovation journal of your country with us. We don't just want you to stop there. What we want you to do is that we will even publish it for you. So we have developed a publisher under a research center called as Nazish Masood Research Center. So that with that publisher, you can even publish your journal. What we want is that your journal should get indexed by PubMed, Medline, Science Direct. And then what we want is that later on that journal becomes first in the top 50% of the journals in that category and eventually in the top 10%. I'm going to mute Emmanuel because Emmanuel, please mute your anyone who joins any meeting, please mute yourself. That's just basic criteria that all of you have to follow. It's a standard that we will apply to all meetings that we have. Um, all this work now for the Health Innovation Journal is being led by Dr. Bilal. So Dr. Bilal will guide you on the indexation part. Basically, we have already built all the training material in terms of the indexation part, in terms of the open journal system. And then simultaneously, during this internship, as you build the journal in your country, what you do is that you work with us. So basically, sort of that journal that you build will be a partnership between you and us. When I say us, what does that mean? That means two organizations. One is Universal Digital Health, and the other is the Nasish Masood Research Center. And through both of these organizations, and we have set up these organizations, we have set up these startups to facilitate your process for the Health Innovation Journal part. That is one part of the internship. Now, some people want to work on the publication part. Well ahead, go ahead, work with us as interns, develop these journals under the leadership of Dr. Bilal, under the leadership of Mr. Asad. The other component of this internship is, and you can join both the internships together. We have allowed people to join both internships. The other part of the internship is that you can join the grant writing part. Now, all of you are based in a country, like some of you are coming from Nigeria, someone is coming from Pakistan, someone is coming from Iran, someone is coming from XYZ, any country. We have set up meetings in Bangladesh. The purpose is that we have set up these private limited organizations, such as Nazish Masood Research Center, which is a research center based in Pakistan. We have set up the Health Innovation Journal along with it. At the same time, we have developed the Universal Digital Health. Again, it's a private limited company based in Pakistan. The purpose is that as you go into grant writing, you apply grants for the university where you're based at. Say, for example, someone is based in Nigeria, in a university, in a public university. As you apply for the grant, now you don't know how to apply for the grant. No problem. We have set up a workshop for that, a free workshop already available on YouTube. You go through that workshop. But that's not enough. As you apply for that grant, we partner up with you. These private limited entity, they partner up with you. Again, Dr. Bilal is an expert at grant writing. He has done multiple grants with me. He has done multiple grants separately with other organizations. He has independently worked on multiple grants. He has led grants. Dr. Bilal is someone who you can easily, he can be your mentor when it comes to grant writing, when it comes to managing grants. I am also here available. You must understand why we are doing all this. The reason why we are doing all this is that we want to build capacity in the global south when it comes to research, when it comes to grant writing. And why are we focused on grant writing? Because, well, when you write grants, that brings in funding. Through that funding, we can take up larger projects. Now, we want you to identify grants in your own country. Those could be grants coming from internally from the country, or they could be external grants coming from funding agencies. What we do here is that we partner up with you, we provide you all the support and all the technical support. And say you need an international consultant for that, we bring in international consultant for it. And I don't include international consultant like just me coming in all the grants. No, if say you need a specific consultant, we identify those consultants, we bring into that grant through the Nazish Masood Research Center or through the Universal Digital Health, through both these mechanisms. Well, how does that help you? That gets grant to you as the PI in your country. At the same time, that brings in our entities as sort of like partner organizations. So that's a win-win. So one part is the publication part. The biggest, the greatest bottleneck for people in global south when it comes to research is that they are unable to showcase their research. They are not able to showcase their research because of the bottleneck of publication. So from on one end we solve the bottleneck of publication, on the other hand there is a lack of funding for research projects. So we get those fundings by writing grants, helping you win those grants. And once you get those grants, obviously the entities that work with you, like Nazish Masood Research and Universal Digital Health, they become partner with you in those grants. So it's a win-win. Your career goes up, you get external help from external consultants. A lot of those consultations might not be available in your country, as is the case with Pakistan. Sometimes consultants are not available in Pakistan. So then we can get those consultants from the global south, but from some other country. Let's say the consultant is based in China, the consultant is based in Malaysia. We got those consultants. And this is like, on one hand, you develop these linkages. On one hand, we develop this global consortium and we apply and apply and apply. We get better and better grants. So that's the vision for this internship. You can work with us for as long as you want. We are here to support you, to mentor you. Eventually, you become the subject expert. You become the leader in your country. That's the vision. We don't want to develop the leadership in one country. No, we want to spread it out, democratize publication, democratize grant writing, democratize research work. Furthermore, this group itself, say you talk to people in the same group, You have a question, you can post it in the same internship group, and people in the group help you out. So that's also there. So peer-to-peer learning, peer-to-mentor learning, and then obviously where you require organizational support, we provide you international organizational support. Where you require technical support, we provide you with technical support. We help you set up the journal, we help you grant writing. So think of it like you are basically building amazing stuff when it comes to research in your own country. So this internship is not just you doing some research work with us. We have had previous internships where people did meta-analysis with us. We have had internships with where people did secondary data analysis with us. This is not a simple research internship. We now want you to build organizations that help you and your country, and at the same time that help the global south, so that we can make research publication and conducting the research more democratized, and you guys are the engine for that democratic process. So I will just stop here and I will hand it over to Dr. Bilal. Thank you.
Thank you, Dr. Hassan, for explaining the whole process, the vision of these internships. So, if anyone have any question, query, concern, please go ahead one by one.
Okay, so I think even if there are no questions, what we can do is that you guys are in the group, this recording will be there, and then we can work around. And I understand orientation sessions are like that, but you must understand that we are people who are sitting here with you, and all the people, Dr. Bilal, me, Mr. Asad, are sitting here because of one reason that basically joins us. That reason is not that we are from Pakistan. That reason is not that we are from healthcare. No, the reason for that is that we have a singular mindset, and that mindset is that we believe in merit. So anyone who is meritorious, we work with them, regardless of whichever country they are from around the globe. Now, if you want this internship to help you, you have to show merit. How do you show merit? By putting in the hours. If you put in the working hours, you get the results. You want, because say Dr. Bilal will work with you to the point that you want to work with him. But in case you are not responsive, you are not delivering, then eventually, basically, that this happens with all the internships around the world. So you will lose out on that. This is what it is. So we just really want all of you to understand that it is the merit that is the link between you and us. We want to develop meritorious people around the global south, around LMIC countries, low middle income countries, where there is actually a need for this stuff. Once we build this stuff, once you guys are in a leading position, you guys can be mentor, you guys can set up organizations like we have set up organizations in your own country. And then you can, propagate this stuff in your own country. You can grow in your own country, you can help people around you grow. But as a starting point for this internship, there is a pathway that you have to follow. The pathway for those who are in the journal category, basically they have to set up their own journals. So the step one is that they have to go through the workshops. Step two, they have to consult with Dr. Bilal as they start to set up their own journal. You can reach out to him in the group, and then he will reach out to you. You can have weekly meetings, or we can even have bi-weekly meetings. What that means is either we can have meeting every week or we can have fortnightly meetings based on the group. And then as we start to set up the journal, Mr. Asad can help us with the technology part. No problem. All of you can get that support. In case you require funding for, say, getting a URL, we will provide that funding. We will provide the URL to you for free. URL is basically your website for free. In case you require support when it comes to server, when it comes to where will you host your website, we will provide you with that support. So, and then obviously, as you build the journal, we build a editorial board. We help you build that editorial board. We provide you with the consultants. Not just that, we help you with the indexation part. Where you need support with the indexation part, we provide you support with that. But you have to play the major role, put in the hours, set up that work, and inshallah, and God willing, we would have our journal set up in multiple countries around the globe. And this is what we want. We have built a health innovation journal as a global journal, but we also have built the health innovation publisher. So we want health innovation journal in Nigeria. We want health innovation journal in Iran. But who's going to lead that work? It is you guys who are going to lead that work. We want Health Innovation Journal in Pakistan. We want Health Innovation Journal in India, Health Innovation Journal in Bangladesh, so on and so forth. Health Innovation Journal, Uganda, Kenya, Tanzania, Sierra Leone, Sudan, Libya. We are going in that direction. We are meeting multiple people in that way, but you guys become the leaders for that work. Similarly, we want to develop grants. Now, you must understand that grants are not given to individuals. Grants are given to organizations. So we have set up two consultant organizations, like I said, Universal Digital Health and Nazish Masood Research Center. But we need organization, which means we need a university in your country. So you apply as the primary investigator in your country, from your country, for a grant. We help you with that grant. You work along with Dr. Bilal in that grant, and then God willing, we achieve the grant. We win the grant. So that helps you become lead the research part. That also helps you set up a whole journal in your country. So I hope this is something that is going to be fascinating for all of you. I hope this is something that is going to help you and help your country, not just you, your country. Because I know that all the countries in the global south need this kind of work. We don't have the capacity. So first we are building the capacity. And why stop at one journal? You build one journal with us, that would be with our publisher. But say you want to build another journal later on with another publisher, who's stopping you? Say you want to build your own team, who's stopping you? Build your own team. So and this is what I say time and again. We have been doing this, me and Bilal, for the past 8 to 10 years. We have not been working together for the past 8 to 10 years, but definitely Bilal has been working at his own end, and I've been working at my own end. And for the past 2 years, we have been working together. And I think that this is how we create leaders within healthcare in the global south. So I hope this is helpful. I think we should not take any questions right now, Bilal. I think any questions that you guys have, they can just post it in the group, and then we move from there. The problem with me is that I will not be the one who would be leading all this work. I would be the one who will be working with Dr. Bilal. Dr. Bilal is the one who will be leading this work. So you reach out to him for anything you want. And obviously, he also has a bandwidth because, he's working with multiple countries right now. We just had a meeting yesterday with Sudan, someone in Libya, and then we are having another meeting in Bangladesh. So a lot of the time you would have to do a lot of self-help work. So you would have to help yourself in a lot of places. That doesn't mean that we are not here to help you out, but the purpose is that we make you as independent as you possibly can. This is not a regular internship. Like the way I've explained it to you, this is an internship that basically helps you and your country reach better standards in publication, reach better standards in grant writing, and obviously all of you can go to our other workshops on meta-analysis, other workshops on data analysis using R and Python. We are setting up a whole master's in data science. Any one of you can do that master's in data science for free. These things are like 40,000 pounds if you do it from UK. They would be like 70,000 US dollars if you do it from the US. The reason why we are making it free is because we understand that people from the global south, researchers from the global south, I have been one myself, I am one myself, cannot afford this. So we understand your pain. And that's why we are doing all this work. And I think this is the starting point of a great journey. Think about what we could achieve 5 years down the line, 10 years down the line. By 2030, our vision is to create 25,000 data scientists in the global south. Our vision is to create 10,000 medical robotics experts in the global south. And that democratizes healthcare as a whole, not just medical education. So I'll just stop here. I have the habit of doing a verbal diarrhea, so I'll just stop here. So over to Dr. Bilal. I will stop the recording, Bilal, if that is okay. And yeah.